This is part 3 of the pediatric lecture for Clinical 2, and we are beginning with pediatric injections. It's very important that we do our injections appropriately for all of our patients, but our little ones require a little bit more tediness and sophistication, and I'm sure we're all going to be a little bit leery of injecting a small patient. So let's talk about this a little bit. The way that each child experiences getting their very first injections, moving on up and up and up in age, that's going to set the pace for how they are going to act each time they come in to get injections. So you want to make sure that you're confident, you're not scary, and you're truthful with your patients. So let's talk about some other things that go along with our injections here. If you have a child that is old enough to understand what's going on, you definitely want to be honest and get their trust. So you're going to tell them it will hurt, but only for just a second. That you're going to tell them that the medicine is there to help them get better and stay well, if whichever one you're giving them. If it's an immunization, for a childhood immunization, we're trying to make sure that they don't get sick. If it is an injection because of an illness, then hey, we're trying to make sure that they get better. So when we're doing our injections, it's always helpful to have another person in the room to hold the patient, because it scares most children to be restrained, but if you can have somebody trying to take their mind off of what's going on, it does tend to help. But sometimes we do have to restrain them, and that's when their muscles tense up really bad, and they tend to have more pain, is what I've seen. So where is the best place to give an injection in a pediatric patient, and what kind of needle do we use, the length, the size, the gauge? Let's talk a little bit about that. So most of our injections are going to be intramuscular, IM, and it does matter the gauge and length of the needle. How do we decide? Well, we actually look at the type of medication that we're going to be giving, but most importantly, we're looking at the size of the child. That is the biggest thing that we have to look at. So let's look at these lengths and gauges, okay? So for an IM injection, the length of that needle is going to be between a 5/8 and an inch, and the gauge is going to be between a 22 and a 25. It kind of depends on the thickness of the medication. Most offices use a 5/8 or 25 gauge 5/8 inch. For sub-Q injections, remember now this is going into the subcutaneous tissue, kind of that fatty layer. This is going to be a 3/8 to a 1/2 inch, and the gauge is going to be between a 23 to a 25. Again, most offices are going to use that 25 because it's smaller, tends to be a little less painful, but it does work. If you've got a thicker medicine, then you've got to use a thicker needle. Now, the site, that's very important. It matters. It matters because little babies do not have muscles in their arms or in their glutes. So we will not inject babies in their arms or in their glutes. The best place to actually inject our little bitty ones is the vastus lateralis. So we've got to remember, let me go back to this slide and start from there. You're going to look at your package insert to see where's the best place for certain medications. One of the places is the dorsogluteal. Until that child is walking, the gluteus muscle is too small and not well developed. That's what I just said. I didn't have to go back, sorry. But it is close to the sciatic nerve. Remember, if you've taken pharmacology, we've talked about this. We want to definitely avoid that in every patient, but the pediatric child, they haven't developed any kind of muscle back there yet. So this can cause some serious trauma for the patient and pain. So back to where we're going to give this injection. It's the vastus lateralis. Vastus lateralis, not just the thigh, but the vastus lateralis, okay? So it's on the anterior medial thigh. And you can see the picture in your textbook. It's kind of like you squeeze that little thigh and it's kind of on the side. So this gets away from all those major nerves and blood vessels, and it also helps us to get as the biggest muscle that they do have already, and get there for that medication to be absorbed properly. Okay. The length of that needle, again, we want to be very careful. The smaller the child, we want to go with a 5/8, but an inch is typically used. That's going to be per preference of your physician and the child size. Okay, so we want to be very careful with that. The deltoid, remember, this site should not be used to inject any medication until that patient is at least 18 months old, because this is when they're actually going to be developing those muscles that they need to have in their arms in order to get that medication administered in their deltoid. Okay, so we definitely want to be honest with those children, let them know that that injection is going to hurt it for just a second. Most of our babies, the parents are going to be more upset than the child, but it does hurt. So we do typically want someone to hold that baby so they don't squirm around, and just be ready. It's going to hurt. So let's talk about immunization. What does immunity typically mean? Basically, it's that the body's resistance to the effects of any harmful agents, such as like a toxin or a microorganism. It's basically given through these vaccines, and we have that active artificial immunization. So this is where we're actively giving someone a shot so they can become immune to certain different types of diseases. So the vaccine is a suspension of an attenuated or a weakened or killed microorganism. So this is when we really like to talk about like the flu shot. So remember, it is not a live vaccine. It cannot give you the flu. Back to active. So now let's go back to that active artificial immunization. This is becoming immune through that vaccine or toxoid. So what is a toxoid? It's that poisonous toxin that is produced by a bacterium, and we're trying to make sure that the child does not develop into having any of these disease processes that are caused from a toxoid. Okay, so what's the purpose of an immunization? We've talked about it. We've kicked this dead dog to death. Is to build the body's defense mechanisms and to protect these children from certain infectious diseases. So there are a slew-doodle of them. You can see there in your textbook. There are several vaccines, but we want to do these during our well child visits. So we need to become familiar with each of these visits. What are we using them for? What's the best place to give them? So the common site. The route of administration, meaning is it sub-Q, is it intramuscular, what the proper dose is, and how do we store it? Is it best stored on the counter, or is it best stored in the refrigerator? Every immunization, every vaccine comes with an insert from the manufacturer to tell us what is the best way to store it, and all that good information we just discussed. Also, you can find that information in the PDR. So let's look at all these vaccines and immunizations that children can get. So we're looking at all the immunizations administered to infants and children. So you have hepatitis B, which that's wonderful. All of our children get those series of hepatitis shots now, or the hepatitis B specifically, with their childhood vaccines. You have the DTaP, you have the Hib, the IPV, the PCV, that's the pneumococcal, the rotavirus, which is the RV. You also have the MMR, the measles, mumps, rubella. Then you also have a varicella, hepatitis A, the meningococcal vaccine, the HPV, which that's one that's elected. You don't have to get that. And then, of course, the influenza. So, can we administer certain medications with others? All right, some of these are combination drugs, believe it or not, which is really cool because you only have to stick the child once and you might have 2 or 3 vaccines all in one. So this is really cool. It's less stress for the medical assistant who is giving the vaccines. It's less stressful for the parents, and of course, less painful for the patient. So, what all do we have to do for immunizations? We have to be careful and document. We have to record that information on their well-child visits, documentation. It's also on their blue card that everything gets transposed over to, so we have to make sure we document that. It's important for school. Some of the other information that we have to record and provide to our patients, family members. What are some of the normal side effects of these immunizations? What are we going to do if they start having these side effects? So there's this cool thing that the CDC developed called a VIS, Vaccine Information Statement. And this is something that we have to give out to every patient, family member, parent, whomever, with every vaccine that we give them. So what all does it have on there? Well, it's got the adverse reactions. It's got the National Vaccine Injury Compensation Program, how to get more information about childhood diseases and vaccines. There's very important that we give those VIS forms out so everybody that has that child can understand how they're going to be acting. Some typical side effects. What it's going to prevent them from contracting. Very, very important. When we give that VIS form to that parent or guardian, we do have to allow them time to read the VIS and then give them an opportunity to ask questions. Yeah, that's something that we typically have trouble with. We're just like ready to wham bam, thank you ma'am, give the vaccine and get them out the door. But no, we have to take time and do this. And actually we do this with other patients. We do this in urgent care when we're giving any other vaccine. So every patient knows about the medication that they're receiving, and they have to sign that VIS area on the consent form. So in the patient's chart, medical record, there is a permanent log that we also have to have in the office that has to have the name and publication date of the VIS that's given to the parent, the date that the VIS was provided to the parent, and the date of administration of the vaccine. Okay? Now, we also have to have on there the manufacturer's lot number in the vaccine, a signature and title of the healthcare provider who administered the vaccine, and the name and address to the office. So all that's important. We've got to have that on there. Okay?